Hey everyone, Dr. Fortes here, and we are talking about breast augmentation surgery. There are two types of implants that are used for breast augmentation. One are implants made of silicone gel, which is a firm silicone rubber on the outside and a silicone gel material on the inside. Those are silicone implants. And then there are saline implants, which have a similar silicone shell on the outside, but they have a valve and they are filled with saline at the time of the surgery. And the big difference between silicone implants and saline implants in terms of the look and feel is that silicone implants, generally speaking, can look more natural and even more importantly, feel more natural. The difference between placing the implant above the muscle versus below the muscle, it's a technical question. When an implant is placed below the muscle, that means that the implant is placed underneath the pectoralis major muscle and it's placed in a plane that allows the implant to be covered up by more tissue. And contrast that to placing an implant above the muscle where it's literally sandwiched between the breast tissue and the muscle itself. So it's a more shallow placement of the implant. So the big difference between those two is that there's more tissue covering up the implant when it's in a submuscular or subpectoral position compared to when it is in a subglandular position. Well, the big difference there is that because there's more tissue covering up the implant looks more hidden and softer in appearance, especially in women who are very, very thin and have very small breasts to begin with. The edges of the implant, when it's placed underneath the muscle, can be hidden more in those situations. Great question. Post-operative recovery from breast augmentation is not complicated. Patients usually have their surgery on an outpatient basis and they're wrapped up in the initial dressings and they go home and they follow up in a day or two after surgery. At that first post-op visit, we do the unveiling. I have patients do their own massages and show them how that's done. And for about 6 weeks, they're wearing a sports bra. At the end of the first week, usually patients are driving, they're back to work, they're doing light exercises, but no chest exercises yet. And so that's usually the typical recovery from breast augmentation. Well, that's a great question, but it really starts with selecting the surgeon that's best for you. And that starts with finding a surgeon that is board certified by the American Board of Plastic Surgery and finding a surgeon that has a lot of experience doing the operation. And that usually means having great reviews online. And the best way to do it actually is to have a friend who has had a great experience with someone who is board certified and a lot of experience. The last thing is do your homework. Investigate the operation, get to know as much about the operation as possible. What does post-operative care look like for breast augmentation? Well, the operation is not a long one. It usually takes about an hour to an hour and a half to do. I do it in our surgical facility with an anesthesiologist who does general anesthesia for my patients. After surgery, the patients recover in the recovery room for about an hour and a half and they go home after that. I usually tell patients take about a week off to recover, and during that week, they'll follow up with me. I'll show them how to do their own massages at home, their own breast massages. They'll be wearing a sports bra for about 6 weeks. And probably by the end of that first week, they're driving, they're going back to work. Well, lots of misconceptions surround breast augmentation surgery. And the idea that they are always looking fake is not true at all. There are many women who want to have breast augmentation, who want to have an unoperated and very natural result. And that comes from examining the breast and talking to the patients to see what size they would like to be and determining what implant is going to work best to achieve a result that meets their size expectation but also can look natural. There are also some women that say, you know what, I want for it to look like I had breast augmentation, so I want the round fake look, and that can be achieved as well. Breast augmentation is an awesome operation that gives predictable and long-term results, but it's important to know that probably at some point the breast implant will need to be retired and removed from the body. No new implant or a new implant replaced. But after 10 years, come back to your plastic surgeon. And I always tell patients, come on a regular basis, do your checkup on a yearly basis to make sure that the breast augmentation you need to do well. But usually about 10 years. Well, breastfeeding is a complex set of physical, anatomical, and physiologic conditions that allow for a woman to breastfeed her baby. But I'm here to say that generally speaking, when breast augmentation is done through this place in the fold, it's placed in a space that is completely away from the ducts and from the breast tissue so that it's anatomically impossible for it to prevent the ability to breastfeed. But as I said, breastfeeding involves a coordination between hormones and the ability for the baby, and very little to do with breast augmentation.